Greetings from Indian Journal of Anesthesia. I, Dr. Khushbu Pandey, will be presenting an original article from the Indian Journal of Anesthesia, April issue. Evaluation of two doses, 20 ml and 15 ml of 0.25% bupivacaine in pericapsular nerve block for patients positioning for sub-arachnoid block during hip fracture surgery, a single-center randomized comparative trial. Fractures of the hip joint are quite common, often requiring surgical reduction and fixation. The analgesic effect of femoral nerve block and fascia iliaca blocks for positioning of the patients for spinal anesthesia is only moderate because of obturator nerve sparing. The pericapsular nerve group block, that is the PENG block, is an ultrasound-guided technique that targets the articular branches of femoral nerve, accessory obturator nerve, and possibly obturator nerve. The data for evaluating different volumes of local anesthetic agents for instituting the PENG block is still lacking. This study was planned with a primary objective to evaluate and compare the effectiveness of two volumes of 0.25% bupivacaine, 20 ml and 15 ml by using the ultrasound-guided PENG block to relieve pain and improve the ease of positioning of patients for instituting subarachnoid block. It was hypothesized that 15 ml of 0.25% bupivacaine should give as desirable effects as 20 ml in PENG block for positioning patients during subarachnoid block. The trial was approved from Institutional Ethics Committee. It was registered under CTRI and it was a randomized double-blinded comparative parallel group trial. Participants scheduled for hip fracture surgery under subarachnoid block, 40 to 90 years age group, and belonging to ASA groups 1 to 3 were included in the study. Patient refusal for spinal anesthesia, infection at the puncture site, coagulopathies, neuropathies, parturients, and any other contraindication to subarachnoid block was considered an exclusion. So the study had two groups. Group A, that included 30 patients who received 20 ml of 0.25% bupivacaine in the PENG block, and Group B had 30 patients who received 15 ml of 0.25% bupivacaine in PENG block. The primary outcome was to measure the ease of positioning of patients with hip fractures to conduct subarachnoid block, and the secondary outcome was to measure the pain at rest and 15 degrees leg raise positions at 3 time points, T0, that is before the block, T10 at 10 minutes, and T20 at 20 minutes after the block. The sample size was calculated based on a previous study where the mean SD of EOP for subarachnoid block was 2.65 and 0.67, assuming a reduction of 20% in the 15 ml group, 80% power, and alpha value of 0.05, a sample size of 25 was obtained in each group. With a 20% non-response rate, the sample size of 60 with 30 patients in each group was considered sufficient. EpiInfo software version 7.2 was utilized to calculate the statistics. Wilcoxon, chi-square, and Fisher-exact tests were applied wherever appropriate. Regarding the results, the demographic characteristics were comparable in both the groups. The primary outcome was to measure the ease of positioning, and the grade was 2.47 in Group A, whereas it was 1.87 in Group B. Also, the ease of positioning grade 3 was obtained in 18 patients in Group A, whereas it was only in 4 patients in Group B, which demonstrated an optimal block. Furthermore, support was required for 4 patients in Group A, whereas in 8 patients in Group B. Regarding the secondary outcome, the VAS scores at rest and at 15-degree leg raise positions were noted. At rest, the VAS scores were lower at time points 10 and 20 in Group A, which is 1.13 and 0.3 as opposed to 1.6 and 0.9 in Group B. The differences were statistically significant. Similarly, at 15-degree leg raise position, The VAS scores were lower in group A and it were 5.7 and 2.9 at time points T10 and 20, whereas in group B, they were relatively higher, that is 6.8 and 5.5 in group B. Again, the differences were statistically significant. The ease of positioning for subarachnoid block improved with both 20 ml, 15 ml volumes in pen block. The patients could sit much more comfortably and without support when 20 ml of the drug was used. There was a decrease in pain scores and it was much more significant with 20 ml of 0.25% bupivacaine. Therefore, pen block is an effective technique to achieve perioperative analgesia and anesthesia alone or in combination with other conventional techniques. With time, various aspects of the block, such as volume of the local anesthetic needed, its concentration, and its use in combination with other blocks are being explored. The study's strength includes its robust methodology, randomization technique, and double blinding, whereas as a limitation, the results were evaluated only till the institution of subarachnoid block. The assessment of the effectiveness of block intraoperatively and postoperatively was not done. Patient satisfaction scores were not assessed, and a greater sample size may be needed to define optimal local anesthetic volume and concentration used in pen block in adults and children, and to establish the advantages of pen block over other conventional techniques. Therefore, it was concluded that patients undergoing hip fracture surgeries for instituting an ultrasound-guided pen block for patient positioning for subarachnoid block, a volume of 20% of 0.25% bupivacaine is more effective than 15 ml volume. Thank you.